Okay, thank you. Looks like we're ready to go. I'm Tom Hudako from the Utah Department of Health, and welcome to today's COVID-19 daily media briefing. We will have one speaker today. That will be Dr. Angela Dunn, the state epidemiologist with the Utah Department of Health, and Dr. Dunn will be providing a situation update for us today.
Okay, good afternoon. So we now have 4,233 cases of COVID-19 identified in Utah. That's an increase of 110 from yesterday, or just a 3% growth rate. We have now tested 100,195 people for COVID-19, an increase of 4,493 from yesterday, and we are now at a 4.2% positive rate, so decreasing our positive rate here. We have only increased our hospitalizations by 4, so total hospitalizations due to COVID-19 is 349. And we still maintain 41 deaths. That's the same as Saturday. So these are very encouraging numbers. And in order to keep driving our transmission rate lower, especially as we reopen parts of our economy, we're working on expanding our contact tracing efforts as well. So we want to be able to identify additional contacts and test them for COVID-19. Up until this point, we have been identifying any close contact 2 days prior to symptom onset for a confirmed case, and now we're going to be extending that to go 7 days backwards. This is going to allow us to identify more individuals with a likelihood of having COVID-19, test them for COVID-19, and recommend isolation if necessary. And this will help us continue to control COVID-19 spread here in Utah. With that, I'll take some questions.
Dr. Dunn, this is Michael Orton with the Capitol News Service going through the Facebook journalism project as well. And we are interested in knowing, you've mentioned the growth rate and also the positive test rates have been either stabilizing or even declining, but they're still increasing. Isn't it important to know that? And secondly, as we look towards normalization of the kinds of restrictions that we've been talking about, does it make sense to go on a county by county basis, given the mayor of Salt Lake City's announcement over the weekend?
Yeah, so for the first question about case growth rate, we are seeing an additional number of cases every single day. However, that growth rate is slowing down, and so that's a good sign that we are entering a plateau phase. So we're going to watch that, and hopefully that continues for at least 2 weeks or 1 incubation period. In terms of the positive rate for our tests, we want to see that go low. So we want to increase the number of people we test, but decrease the number of positives we have with all of those tests. That's a sign that we're testing everyone that needs to be tested for COVID-19 while also controlling the spread. In terms of being able to do social distancing or policy recommendations county by county, this pandemic is impacting every geographic region a little differently, and every geographic region has different types of populations and different ways that the disease is spreading. So I think it's important for elected officials to be able to take all those individual situations into consideration when implementing policies. So what Salt Lake City is seeing in their jurisdiction is likely very different than what, for example, Southern Utah is seeing. And so policies need to be different as well. So it's a good thing that they're able to tailor it to their needs.
What kind of recommendations have you made specifically to, or through the task force to the governor's office and or other policymakers most recently?
Yeah, so we look at our trends in case rates. And so what we're seeing statewide is a slight increase in cases over the past week. However, those reporting delays could play a part in what we're seeing. So we're looking for a 2-week trend in plateauing followed by a decrease in cases. And we're providing those numbers to each local jurisdiction as well so that they can see how the disease is spreading in their jurisdictions. So whenever we're in contact with elected officials or our local health departments, we advise them on looking for that plateau followed by a decrease.
Thanks so much.
Yeah, Dr. Dunn, this is Ben Winslow from Fox 13. The state is now contemplating going from red to orange in risk level, possibly by the end of this week. So is that a good idea in your opinion? Is it too soon? Is it just right? How do you feel as the state epidemiologist about some of these things the governor and others are contemplating?
Sure. So I can tell you that this phased approach of red, orange, yellow, and green is very prudent. I was part of making the recommendations for what opening a business looks like in each one of those phases, and it is a very slow approach. So when we move from red to orange, life does not go back to COVID-19 ways. There are a lot of restrictions that are placed on businesses opening to ensure social distancing and ensure prevention of COVID-19 spread. And so I think that's the right way to do it, is kind of to do this slow rollout of opening up of businesses while continuing to monitor for disease. So if we see an increase in cases, we increase the restrictions back again. And that's the way we're going to be able to find that balance between controlling the disease as best we can and also preventing a huge burden on our economy.
But are you foreseeing any kind of going from red to orange, then back to red? Are you anticipating that in the coming weeks or months?
Yeah, so the goal is no. The goal is to, go from red to orange and continue loosening up restrictions, because hopefully we are seeing a better control of COVID-19 here in Utah. However, it is good to know that we do have those triggers that will alert us that, maybe we move too soon and we need to increase the restrictions back.
Hi, Dr. Dodd. This is Carter Williams with KSL.com. My question is related to travel, and as the state eases some restrictions, will it be safe to travel outside of the state? And what advice would you give people who still plan on taking out-of-state vacations in the coming months?
Sure. So, our federal partners, especially the CDC, still recommends against non-essential domestic travel, and that's true for the state of Utah as well. We certainly know that there are higher case rates in other states, and that would increase somebody's likelihood of getting COVID in another state and potentially even bringing it back to Utah. So non-essential travel is still recommended against at this point in the outbreak.
Do you anticipate that to continue in the next couple of months?
A couple of months, it's hard to tell. This seems to change hour by hour. So our recommendation right now is definitely not to have non-essential domestic travel. We'll keep you updated as that changes. Nationally, we're still in the acceleration phase for this outbreak. That means that as a whole, the U.S. is seeing an increase in the number of cases and the increase in the growth rate every single day. So it's definitely not controlled. And so, we won't open up those domestic travel restrictions until we start seeing more of a plateau nationally.
All right, thank you.
Yeah.
Dr. Dunn, the World Health Organization this weekend said that there is no evidence that those who have had COVID-19 and recovered are immune from catching it again. How does that impact the way that our state will approach reopening, and how does that impact certainly, we're hoping that those who have had COVID-19 and recovered could get back to work more quickly. Some countries are even considering immunity passes. So with no evidence that this provides immunity, how does that impact the way that we go forward and try to reopen our state?
Yeah, so we as a health department have advised leaders that we don't know anything about immunity due to COVID-19. There is currently no evidence that any individual does become immune after getting COVID-19 and recovering. We can assume that if it's similar to other coronaviruses, that there is some level of immunity, but we do have evidence from other countries coming out that reinfection is possible. So until we really know the impact of developing immunity due to COVID-19, being able to reopen things based on immunity is still a gamble. And so that's why we recommend this slow approach to opening up the economy, where we still have social distancing measures in place and still have interventions that prevent the spread of COVID-19 in the event that immunity isn't strong or doesn't last very long. So that's definitely part of our plan. We don't make the assumption that anybody's immune.
In light of this, what recommendation would you make to those who have had COVID-19 and then are well now?
Yeah, so there is a chance that if you've had COVID-19 and you recover, that you could be reinfected. So it's still important to maintain social distancing practices in order to prevent the spread of COVID-19 from you to others, and then from you becoming reinfected as well.
Thank you.
Dr. Dunn, hi, thanks. Experts nationally have said that the death toll from COVID-19 is likely to be an undercount, that there have been more deaths caused by COVID-19 than have been confirmed. How confident are you in the accuracy of the state's count, and what steps is the health department taking to go back and check for excess deaths, for example, so that the count can be as accurate as it can be?
Sure. So our current practice includes any death that goes to our Office of the Medical Examiner is being tested for COVID-19. So that means that anybody who passed away that might not have had a COVID-19 diagnosis before and goes to our medical examiner's office will be tested for COVID-19 to determine if it was related to the death. We also rely on our hospitals and our providers testing COVID-19 patients, especially in the hospital, and they're doing a great job of that. We haven't had plans to actually go back and test, from the beginning of this outbreak and go back and identify deaths, but that is something that we can look for in the future. That's just not in our plans currently.
Okay, but as far as checking, comparing how many people died in the last 2 months this year compared to how many die in an average year in March and April, are those statistics useful in any way?
Yeah, I mean, so we can identify the excess deaths due to COVID-19, and that's reflected in our mortality counts here, where we've had 41 individuals die due to COVID-19. That means that their death, COVID-19 contributed to their death. That without COVID-19, they likely would not have passed away at that moment. So it is an accurate depiction of the mortality impact we're seeing due to COVID-19.
Thank you.
Hey, Dr. Dunn, this is Jacob Klopfenstein from KSL.com. A couple of questions. Firstly, is there any indication in the testing data that the state is collecting if any of those people have been tested more than once? In other words, we're over 100,000 now, but do you know an amount of, if any of those are duplicate tests? And then secondly, for the people who have died due to COVID-19, I was wondering if the health department has any plans to release some of the data that you guys have collected, where those people are from, what age they are, and add it to the dashboard at any point.
Sure. So we at the health department get all positives and negatives of COVID-19 tests. So we are able to identify individuals who have been tested more than once. Thus far in the outbreak, it only amounts to about 200 people that have been tested more than once. And that can be for a variety of reasons, including kind of being negative initially and then showing more symptoms or being re-exposed and getting tested again. So it's not a big portion of the people we're testing who are getting tested multiple times. In terms of death data, we do know that the vast majority of our deaths are occurring in those over the age of 65, especially those over 85. And approximately 80% of them have had underlying medical conditions that contribute to the severity of their COVID-19 disease. Because we have such a small number of deaths, if we were to break out those numbers by individual metrics on the public dashboard, it risks identifying the individual. So to protect individuals' privacy, we won't be releasing those numbers specifically on our dashboard just yet.
Thank you.
Hi, Doctor. You mentioned that you were part of the process deciding how the opening should be. You said it's a slow opening. What exactly does that mean? I mean, what kind of businesses are still going to be shut down with this slow opening? And everybody's predicting when, things reopen, there's going to be an uptick in cases, maybe another surge. So what is the state doing to make sure that we're prepped and ready just in case that, when this increase does happen again?
Sure. So on the coronavirus.utah.gov website, there is a link for the Utah Leads 2.0 plan, and there's an addendum, a public health addendum, that identifies all of the indications for businesses going from red to orange, and it breaks it out by industry, including entertainment, personal care services, restaurants, et cetera. And so in that document, we lay out specific metrics that each business should use when thinking about reopening and how they can reopen safe. So for example, within the restaurants, tables will be spaced, more than 6 feet apart. We encourage outdoor dining. Wait staff will be wearing masks and those sorts of interventions. And we lay that out by each specific industry. So I encourage you to go to the website to be able to look at that addendum in more detail. We are definitely prepared in the event that we do have a surge. We don't anticipate it. We haven't had a lot of restrictions in Utah leading up to now. We don't have a stay-at-home order that is statewide. So it hasn't been a lot of restrictions up until this point. And so we're hopeful that individuals will still maintain social distancing when possible so that we can continue to see the trajectory of cases plateau and go down, even when we do open up businesses in a limited way.
All right, that was me.
Hi, Dr. Dunn. It's Ashley Imlay with the Deseret News. And I wanted to ask, so there are a lot of Utahns who think that they had COVID-19 as early as February. Do you believe the virus might have been in the state then with community spread or interstate travel?
Yeah, so we're definitely looking into that. We're going to be working with hospital systems, and Intermountain is already doing this, kind of going back in time and looking at the people who tested negative for influenza and retesting their samples for COVID-19, or reaching out to those individuals to get an antibody test so that we can identify more accurately when it did come into Utah and what the spread has been. So that is an ongoing investigation that we're doing.
Thank you.
Dr. Dunn, thanks for taking my question. Nick McGurk from ABC4. I kind of wondered, so you're going to go from 2 days to 7 days tracking. What additional resources are making that possible, or is it just where we're at in the pandemic? Just kind of curious how that's going to logistically happen. And then I know that you've been saying a series of symptoms, about 6 of them for a couple of weeks now, but it sounds like the CDC has just put out some new symptom guidelines, and I'm just wondering, is that going to change our state strategy, or are we already there as far as you encouraging all of those symptoms, including chills and shortness of breath, the expanded list? Sounds like the nation's on board now. Just curious if that's going to change anything we're doing here in the state.
Sure. So the expansion of contact tracing will definitely take more resources at the state and local health department level, because we'll have more people to do contact tracing for. To do that, we have mentioned this before, but we have started to build up our capacity using nurse investigators from the Medicaid division and also Intermountain to help us with our contact investigation teams. And we already have state employees that are helping with our active monitoring teams. So we plan to utilize those centralized resources more readily as we expand our contact tracing efforts so that it can still be done in an efficient and effective manner. In terms of, what was your last question?
Well, I was kind of curious as a follow-up. Is anybody using that app, and is that app going to help you trace, or has that been a dud so far? Do you have any kind of data on whether that's helping out at all?
Sure. So I think we have over 30,000 individuals in the state of Utah, maybe more than that have downloaded the app. It will certainly come into play when one of those individuals tests positive for COVID-19 and our public health investigator is able to access their location and help them kind of jog their memory about where they've been during their incubation period so that we can kind of more effectively do contact tracing. We haven't had that happen yet, but I am anticipating within the coming weeks that will certainly be a helpful tool for those who have downloaded it. And then in terms of symptoms, so CDC did release new guidelines for what symptoms look like due to COVID-19, and they match ours almost word for word. The one addition was the addition of chills or rigors, which is basically shaking due to feeling chilled. We don't have that in our current case definition, but we still think we capture everybody who could possibly have COVID-19, and we'll work with our testing team to determine if that's a reasonable thing to add.
Thank you.
Okay, thank you guys so much. Have a good afternoon.